Good afternoon everyone. So we are coming to a very important session. इसमें मैंने I tried to pick all those MCQ which are very important for your examination point of view. Okay. Now tell me, name the type of skull fracture. This image is given depressed fracture, hinge fracture, pond fracture and comminuted fracture. Give me the answer. It is hinge fracture. It is hinge fracture. Now sir, how to identify that it is hinge fracture? Very important one. If you see, it is starting from one side, yes, this side, and going towards other side. It is starting from petrous ridge, then sella turcica, then another side of the petrous ridge. So here answer is hinge fracture. So we will see other fractures, other type of fracture, and hinge fracture is also known as motorcyclist fracture. What is another name of hinge fracture? It is a motorcyclist fracture. It is a motorcyclist fracture hinge type 1 fracture. Okay, you can see the very simple one, this one. This is motorcyclist hinge fracture starting from petrous ridge and going to the other side. Depressed fracture is caused by hammer. Depressed fracture is caused by hammer. Gutter fracture, see, if this is an oblique bullet, it is touching and going, it is a gutter fracture. So tangential bullet or oblique bullet produces gutter fracture. Very important. By fracture, if there is a suture separation, it is a diastatic fracture. Very important one. Fractures surrounding the foramen magnum, it is a ring fracture, and comminuted fracture are also known as spider web fracture. So these are 5 important MCQ you can get in your exam. So this is depressed fracture. This is depressed fracture. Depressed fracture is caused by hammer. Gutter fracture is caused by perpendicular bullet or tangential bullet. The answer will be tangential bullet. That's an oblique bullet. Diastatic fracture is a fracture which is causing sutural separation. Ring fracture is a fracture surrounding foramen magnum. And comminuted fracture, if you see the multiple fracture, that is a spider web fracture. Now anyone who can tell me which is the most common suture to be involved in diastatic fracture, that is a sutural separation. जो सबसे ज़्यादा sutural separation होता है. The most common suture involved in diastatic fracture, it's a sagittal suture. Yes. Now you can get this question. Pond fracture is a child skull fracture which is a elastic bone. If you see the child skull fracture which is a elastic bone, it is also known as ping pong fracture. It is a child skull which is elastic bone and it is also known as ping pong fracture. So these are some very important MCQ about the skull fracture. You can get in your exam. What are the type of skull fracture? Here answer is hinge fracture. Okay, आगे चलो बेटा. Next question. During autopsy of the fetal death, what is the order of examination to differentiate between live birth and stillbirth? During autopsy, which is order of examination to differentiate between live birth and stillbirth? Now, remember my dear friend, one very important concept here. In fetal death case, in newborn case, just remember, yes, here abdomen, head, thorax, A is given, head, thorax, abdomen, D is given by you. No, my dear friend, it is, yes, HAT, head, it is head, abdomen and thorax. Now, the golden rule is abdomen has to be opened before thorax. Head has to be opened first. Why to open abdomen first before the thorax? I would say to see the position of diaphragm. To see the position of diaphragm. Yes, Sejal, absolutely right. You can see these MCQ. In newborn, what cavity has to be opened? Definitely, abdomen has to be opened first to see the position of diaphragm before the thorax. But here, the head will be the best answer. First is head, then abdomen, then thorax. That's very important to see the position of diaphragm. है ना? गड़बड़ी मत करना. In poisoning case, the cranial cavity has to be opened first. In poisoning case, the cranial cavity has to be opened first. Okay, to see the smell of the poison. Okay. Now in asphyxial death, just remember the tricks, that is Citan. That's very important. The first cavity is cranium and the last is neck. What is the sequence in asphyxial death? C cranium, then thorax, then abdomen, then neck. Now you can get one question. Why to open the neck as the last cavity to get the bloodless field in the neck? Because like in asphyxial death, we want to see the injury of the neck. है ना? हम क्या करते हैं? What are the asphyxial death? Hanging and strangulation, and we want to see the injury of the neck. And if you want to see the injury, why do we open in poisoning cases that cranial cavity first to retention of the smell? But anyways, in asphyxial death, the last cavity to be opened is neck to get this bloodless field. ये पक्का ध्यान रखना ना. Which is the last cavity? Bloodless field. And which is the first cavity to be opened? Cranium. That is in asphyxial death. Okay. So anyways, here without any doubt the answer is C. Head is opened first, but abdomen is opened before thorax to see the position of diaphragm. To see the position of diaphragm. ओके तो ये 3 क्वेश्चन पक्का ध्यान रखना. न्यूबॉर्न के अंदर एब्डोमेन थोरेक्स से पहले खोला जाता है. इन पॉइजनिंग क्रेनियम इज ओपन फर्स्ट टू जस्ट retention of the smell. And in asphyxial death it is citan, C cranium, T thorax, A abdomen, and it is neck is last to get the bloodless field. Now a sagar was being tried in the court for murder of Mohan in the park. Seeker appeared in the court and said he saw Sagar carrying a knife. थोड़ा ध्यान से देखना बेटा. He saw Sagar carrying a knife. मतलब सागर नाइफ के साथ पार्क में बाहर घूम रहा था. Okay, what is the evidence? This is known as direct, indirect, hostile, and hearsay. Yes, Harshvardhan Patidar, you are absolutely right, beta. It is a indirect evidence. It is a indirect evidence. Why it is a indirect evidence? Because he has not seen the Sagar killing someone. He has seen Sagar was carrying a knife in the hand, which is not a direct evidence. It is a indirect evidence. Now I will tell you some summary. Now indirect evidence, my dear friend, very very important one. Indirect evidence. It is a type of circumstantial evidence, or it is also known as corroborative evidence. So both are example of indirect evidence. Yes, indirect evidence can be of two types, that is a circumstantial evidence and corroborative evidence. Okay, now what is circumstantial evidence? Like someone's fingerprint. अब अगर जैसे मेरा ना crime scene पे fingerprint पड़ा, my fingerprint are found on the crime scene, that's a circumstantial evidence. And Sagar is carrying a knife in the park, that's a corroborative evidence. And corroborative evidence is a indirect evidence, beta. Corroborative evidence is a indirect evidence. Did you get this question, beta? Is it clear? Now this is match the following: heroin, Eve, joint, LSD, ABCD is given, ganja, acid, brown sugar, and amphetamine is given. Tell me which is the right answer. 1, 2, 3, 4, beta. Yes, 4 is the right answer. As you can see, very simple one, my dear friend. A3 means heroin. One of the variant of the heroin is a brown sugar because both are diacetyl morphine. Okay. B4, you can see B4, Eve is a amphetamine, that is a methamphetamine, MDMA, है ना, आपने सुना होगा, that is a methamphetamine, MDMA, rave drug or party drug, that is a Eve. Joint is, my dear friend, ganja, that is C1. And D2, LSD is also known as acid. Doctor साहब, LSD is not love, sex and धोखा. LSD is a lysergic acid diethylamide, है ना, उसको हम acid भी बोलते हैं. The another name of LSD is acid. Okay, so this is a very correct explanation of this very important question. You can get this question in your exam and the variant of this question in your exams. Okay, so we can see now heroin. Heroin is a type of, you can see it is a brown sugar. As I told you, Eve is a MDMA, or it is also known as ecstasy. It is also known as ecstasy, rave drug or party drug, है ना? It causes amnesia. Joint is a type of cannabis, that is a very very important one, my dear friend, ganja. And LSD, as I told you, LSD is also known as acid. LSD is also known as acid. So very very important. Anyone who can tell me LSD increases what neurotransmitter level in your brain? LSD क्या बढ़ाता है आपके ब्रेन में? CNS में क्या बढ़ाता है? It is serotonin level. It is serotonin level. LSD के अंदर दो और फिनोमिना होते हैं. One is a flashback phenomena, आपको flashback आते हैं. And second is also a very very important one, that is a trip, bad trip or good trip. The answer is serotonin. Okay, चलो आगे चलते हैं. Examination of a rape victim come under which BNSS? ये बताओ बेटा. Examination of a rape victim comes under which BNSS? Which BNSS? Examination of rape victim comes under which BNSS? It's a very important one because doctor examine the rape victim with consent. Which BNSS? It is 184. It is 184. We can see the explanation. Now few important explanation. Very very important one, my dear friend. Number 1. पुलिस मारती है चौका, पुलिस इंक्वेस्ट 194 BNSS, मजिस्ट्रेट मारता है छक्का, मजिस्ट्रेट इंक्वेस्ट इज 196 BNSS. दैट्स वेरी सिंपल ट्रिक. पुलिस मारती है चौका, मजिस्ट्रेट मारता है छक्का. ओके, एनी क्राइम इंफॉर्मेशन, सी इज द थर्ड लेटर. बेटा वेरी सिंपल ट्रिक है ना, बहुत इजी ट्रिक बताइए. सी इज द थर्ड लेटर. एवरी क्राइम इंफॉर्मेशन शुड बी गिवन टू द पुलिस, दैट इज ए 33 BNSS बिकॉज सी इज द थर्ड लेटर. एक बार नहीं, आपको 2 बार इन्फॉर्म करना है. जैसे आपको कोई भी क्रिमिनल केस आए, हाँ पुलिस है, एक बार इन्फॉर्म करो, दूसरा पुलिस साहब हमारे पास ये केस आ गया, 2 बार इन्फॉर्म करो, दैट विल बी 33 BNSS. ये ट्रिक हो गई है ना. और BNSS इज ऑल अबाउट प्रोसीजर, है ना. थर्ड वेरी वेरी इंपॉर्टेंट. एग्जामिनेशन ऑफ एक्यूज्ड. मैंने क्या किया, एक्यूज्ड को मैंने लिख दिया प्रिजनर, P फॉर प्रिजनर, P फॉर 5. 51 BNSS एंड 52 BNSS आर एग्जामिनेशन ऑफ एक्यूज्ड, है ना. मैंने क्या किया, एक्यूज को प्रिजनर लिख दिया, दैट इज ए 51 5-1 5-2. दैट्स अ ट्रिक टू रिमेंबर. एंड दिस इज ए एग्जामिनेशन ऑफ एक्यूज ऑफ रेप केस, दैट इज ए 52. दैट इज ए 52. ए विक्टिम ऑफ रेप, हाउ वुड यू रिमेंबर बेटा? ए विक्टिम ऑफ रेप एग्जामिनेशन, A is a 1 letter बेटा. victim of, that is comprised of 8 letter, and rape has 4 letter. That's a very simple trick and बहुत easy trick बना दिया. Examination of a victim of rape, A is the 1 letter, A एक ही letter है. Victim of has 8 letter and rape has a 4 letter. So examination of victim of rape is a 184 BNSS. These all BNSS are procedure. These all BNSS are procedure. ये चारों ध्यान रखना. पुलिस इंक्वेस्ट 194 पुलिस मारती है चौका, मजिस्ट्रेट इंक्वेस्ट 196 BNSS. बहुत सिंपल हो गया. ठीक है. क्राइम इंफॉर्मेशन टू पुलिस 33 BNSS. Prisoner or accused examination of normal case 51 and rape case 52, and examination of a rape victim, a victim of rape, A 1 letter, victim of 8 letter, that is a 184 BNSS. So that's a very important one, my dear friend. This question is done 184 BNSS. Beautifully done. They are asking punishment. Which BNSS? BNS. BNS is a crime and punishment. BNS. BNS is crime and punishment. Yes. Tell me. 227 is a definition of perjury, beta. It is punishable under 229. It is punishable under 229. 227 is a definition of perjury. Okay. Now, sir, perjury has 7 letter, so it is 7. 227 is a definition of perjury, and automatically the punishment will be after that. That is 229. 229. Now, false certificate. If you are making false certificate, it is punishable under 234 BNS. Now, how to remember? I am making a very simple trick for you. Your true sequence is 1, 2, 3. If you are making true certificate, if you can remember 1, 2, 3 is a true sequence. False sequence is 2, 3, 4. है ना? अगर आपको कोई कहे what is a true sequence 1, 2, 3, that is a true sequence. And what is a false sequence 2, 3, 4? It means making false certificate is punishable under 2, 3, 4 BNS. I have made one very simple trick. है ना? Perjury is defined. Perjury is a false evidence defined under 227 and punishable under 229. Okay. Making false certificate is punishable under 234. I made a trick for you. True sequence is 1, 2, 3 and false sequence. मतलब हम जैसे true sequence बोलते हैं ना 1, 2, 3. But false sequence is 2, 3, 4. That's a false certificate. है ना? चलो आगे चलते हैं. Sir, voyeurism. Voyeurism is seeing a nude girl. If you see a nude girl, that is punishable under 77. Now, how would you remember that? How would you remember? देखो, if you see a nude girl, how do you see? You see one time C for 7, C for 7. So that's a very simple trick. C and again C, 77. So voyeurism is punishable under 70. Voyeurism is punishable under 77. Stalking will be after that. That is 78. That is 78. है ना? तो अगर आप किसी न्यूड गर्ल और गर्ल इन्वॉल्व इन सेक्स को देखते हो, दैट इज ए 77 और स्टॉकिंग इज 78. बट सर इफ यू डू बोथ सेकेंड टाइम, दीज बिकम नॉन बेलेबल. दीज बिकम नॉन बेलेबल. ओके. सो वोयरिज्म में क्या करते हो आप देखते हो ना, सी अगेन यू सी. और ट्रिक क्या हुई? C7 C7, दैट्स ए 77 एंड स्टॉकिंग इज पनिशेबल, दैट इज 78. चलो बेटा आगे चलते हैं. सर डाउरी डेथ इज पनिशेबल अंडर विच BNS? एंड आई एम मेकिंग अ वेरी सिंपल ट्रिक. D dowry, D is the 4th letter, D death 4th letter. Okay, 4 plus 4 it become 8. That's a very simple trick. 80 BNS. Female dies, female becomes 0. So it is 4 plus 4 8, and female becomes 0. That is 80 BNS. So dowry death is punishable under 80 BNS. It is minimum punishment 7 year, maximum life imprisonment. So I have made some wonderful trick for you to remember. Voyeurism हो गया 77, C, stalking 78, dowry death 80. Perjury defined under 227, perjury punishable under 229. 229. ओके, सारा ट्रिक समझ में आ गया. फॉल्स सर्टिफिकेट 2, 3, 4, क्योंकि ट्रू सीक्वेंस आपकी 1, 2, 3 है, फॉल्स आपका ही हो गया ये. क्रिमिनल अबॉर्शन, माय डियर फ्रेंड, क्रिमिनल you have 8 letter in criminal and you have 8 letter in abortion. So criminal abortion will start with 88. Criminal abortion will start with 88, with mother consent 88, without mother consent 89, and death of mother 90. So that's a very wonderful trick I have made for you. Criminal has 8 letter beta, and abortion has 8 letter, 88. Criminal abortion start with 88, with mother consent 88, without mother consent criminal abortion 89, and my dear friend, death of mother, that is next one. Female dies, that means female becomes 0, that is 90. So these are some very simple trick to remember criminal abortion. Now, which of the following eye sign can be appreciated in this image? Anyone who can give me the answer. Is it a Tachynoir? Is it a Kevorkian sign? Is it a corneal changes? It is a vitreous humor changes. Tell me dear, what is your answer? Which of the eye sign can be seen in this? Yes, anyone? Is it Teke-Noir, Kevorkian, corneal changes and vitreous humor? Yes, without any doubt, it is Teke-Noir. It is Teke-Noir. Yes. So Teke-Noir are the triangular change of the eye, generally seen in 3 to 6 hours, generally start with yellow color, then it becomes brown. These are cellular debris of epithelium. So these are seen in 3 to 6 hours. These are triangular changes. These generally start with yellow color, then it becomes brown. These are cellular debris of sclera. That is known as Teke-Noir. These are sclera change of the eye. Teke-Noir. Now Kevorkian sign is a railroad sign. It is a retinal vessel fragmentation. It is the earliest eye sign. देखो दोनों question है अलग है. First eye sign is Kevorkian sign, and the sign which I shown you in the sclera, that was a Teke-Noir. So first earliest sign of the eye is railroad sign. Here retinal vessels are fragmented. Here retinal vessels are fragmented. It is a Kevorkian sign, railroad sign, or cattle trucking sign. So this is another very, very important sign. Now the postmortem staining, this is a postmortem staining picture. It is also known as postmortem lividity, VBCs, sugillation. My dear friend, postmortem staining present in dependent part of the body. It is absent from the pressure area. These are the other name: postmortem staining, lividity, VBCs, sugillation. It is present in dependent part of the body, absent in the pressure area. Because of the deoxyhemoglobin, the color is purple of the skin. This is because of the pulling of the blood, bluish purple color. It is bluish purple color. So you can get few pictures. This says postmortem staining, lividity. Hypostasis, another name is hypostasis, VBCs, and sugillation. These are present in dependent area. These are absent from the pressure area. Because of the deoxyhemoglobin, the color become bluish purple. And because of the gravitational force, there is a venous pulling. Every line is given here. In moving body, postmortem staining is absent, my dear friend. In moving body, postmortem staining is absent, and in hanging body, it is seen in glove and stocking pattern. That is hand and feet. In hanging body, it is seen in glove and stocking pattern. So these are some questions you can get in your exam regarding the postmortem staining. Keep in your mind postmortem staining, postmortem lividity, VBCs, sugillation, and hypostasis. Hypostasis naam mat bhulna. This is another one. Rigor mortis, it is because of ATP depletion. The first muscle, the rigor mortis involved is myocardium, and the first external muscle is upper eyelid. Rigor mortis starts from up and goes down. This is head to toe. This is Nisten law. Rigor mortis starts from head and goes to the toe. That is a Nisten law. So I explained many of these. The first muscle is myocardium. First external muscle is upper eyelid. First muscle is myocardium and first external muscle is upper eyelid. Head to toe it goes because of ATP depletion. It is a Nisten law. This is cadaveric spasm, not rigor mortis, my dear friend. It is a antemortem event. It is seen just after death. So here primary relaxation is absent. Here primary relaxation is absent. It is a very important feature of antemortem drowning. Like if your hand are clenched, this is cadaveric spasm because it is seen just after death. That's why primary relaxation is absent. You can get one question. This is a postmortem change, but it is a antemortem event. This is a postmortem change, but it is a antemortem event because when you struggle, there will be clenched hand. This is antemortem event. ओके तो एक बार क्या किया मैंने सारे पोस्टमार्टम चेंजेस को थोड़ा सा समराइज कर दिया. फर्स्ट मसल इज मायोकार्डियम बट फर्स्ट एक्सटर्नल मसल इज अपर आईलिड एंड व्हाट इज द नेम ऑफ द लॉ? हेड टू टो लॉ, निस्टेन लॉ. वेरी गुड बेटा. सर डिक्लेरेशन ऑफ ओस्लो by World Medical Association in 1970 which refers to which statement? Tell me. Declaration of Oslo. Tell me. Declaration of Oslo. A, B, C, D. Yes, without any doubt, here answer is therapeutic abortion. Here, therapeutic abortion. How would you remember different declaration? Tell me. Declaration of Oslo, you can remember by a very simple trick. Yes. Declaration of Oslo. Therapeutic abortion, double O, that will be declaration of Oslo. OO. Okay. Torture and degradation or cruel treatment of prisoner. Torture, declaration of Tokyo. Yes. So torture was in declaration of Tokyo. Torture was in declaration of Tokyo. Torture, Tokyo. Oslo, it was therapeutic abortion. Yes, very good. Ethical aspect of medical research, that was given by declaration of Taipei. And hunger strike, And the role of a doctor in hunger strike, that was in Declaration of Malta. That was in Declaration of Malta. So torture was in Declaration of Tokyo. Therapeutic abortion, double O. आप देख सकते हो single O, double O, Oslo. Yes. Ethical aspect of medical research in Declaration of Taipei. And hunger strike and role of a doctor, Declaration of Malta. Declaration of Malta. So hunger में आपको माल चाहिए होता है. You can remember by this trick. If you are hungry, you require Malta. That's very simple. These are 4 declarations. Now, sir, this is a very important question. A dead body of 20-year-old man was found in the sea. Here it is sea water, okay? Was brought for the postmortem examination. Which of the following finding would you see in sea water drowning? Tell me the answer. Option A, B, C, D. Tell me the answer. Yes. Yes, sea water. Is it A, 1 and 3? Is it B, 1 and 4? Yes. It is 1 and 4. Yes, without any doubt, it is hypernatremia and myocardial anoxia. Very important question, my dear friend. I will compare both drowning. Here answer in seawater drowning is hypernatremia and myocardial anoxia. You can see in seawater, if you see, my dear friend, the seawater goes in pulmonary capillary. It's a sodium inside, that is hypertonic water. That causes hemoconcentration because sodium in the pulmonary capillaries. Now potassium here is normal. It is hypernatremia, and hypernatremia causes bradycardia, and you will die in 8 to 10 minutes. So very important word is here seawater goes in the pulmonary capillary, that causes hypernatremia. So hypernatremia, hemoconcentration, bradycardia, myocardial anoxia, and you will die in 8 to 10 minutes. Okay. What about freshwater drowning? If freshwater goes in pulmonary capillary, it is hypotonic water. Yes, it is hypotonic water. It is not hemoconcentration, it is hemodilution. Here, because of hemolysis, potassium increases, that is RBC releases potassium, hyperkalemia. Here, sodium diluted, hyponatremia. And hyperkalemia, my dear friend, very, very important. Hyperkalemia causes ventricular fibrillation. You will die in 4 to 5 minutes. So this is a very important comparison. Freshwater hypotonic, seawater hypertonic. Hemodilution, hemoconcentration. Pulmonary edema absent in freshwater, pulmonary edema present in seawater. Now, because of the hemolysis, because of the RBC lysed in the freshwater, because of the hemolysis, potassium comes out hyperkalemia. There potassium is normal. Because of hemodilution, hyponatremia in freshwater, hypernatremia in seawater. Hyperkalemia causes ventricular fibrillation and hypernatremia causes bradycardia. So without any doubt, you will die earlier in freshwater drowning. Fatal period is 4 to 5 minutes, and in seawater, fatal period is 8 to 10 minutes. This is a very important comparison you can get in your exams. Very, very important, my dear. Now, sir, a police recovered beheaded skull bone and relative of missing person gives the photograph of missing person to police. Means it is a comparison of skull bone and photograph. These two samples can be analyzed by which technique? Option A, fingerprint. Option B, DNA fingerprint. Option C, superimposition. Option D, chiloscopy. Yes, it is, yes, without any doubt, my dear friend, it is superimposition technique. It is skull is compared with the photograph. It is superimposition technique. Fingerprinting or Galton system is best for criminal identification. DNA fingerprint are mostly used for decomposed body or DNA analysis. Chiloscopy is the study of lip print. That is very, very important, my dear friend. So anyway, skull compared with the photograph, it is a superimposition technique. DNA analysis for decomposed, fingerprinting is the best for criminal identification, and chiloscopy is the study of lip print. Yes, absolutely right. Sir, a 23-year-old farmer working in the remote village, he had a snake bite in the morning. There was a headache, blood vision, tingling sensation surrounding the mouth, dizziness, vertigo, had a multiple episode of vomiting since the bite. He has a sign of respiratory distress, that is the respiratory depression and bradycardia. Okay. So that means you are anticipating there are no apparent bleeding manifestations. So no bleeding, that means viper is ruled out. And he has a mild swelling and blistering, that is local symptoms are present. He was administered 10 vial of antivenom. It means, sir, it is respiratory distress. It's a neurotoxic snake, my dear friend. You will go for, it's a cobra bite, and for cobra bite, you will go for neostigmine and atropine. Yes, it is a cobra bite. It's a LAPD. Yes, Raju Mahapatra is absolutely okay because recently we had a question. The Ilepidae group is a neurotoxic snake, beta. Neurotoxic snake, Ilepidae. Very good, beta. Now, sir, this is treatment. If you see in the cobra bite, we give neostigmine along with atropine. The dose is also given neostigmine 1.5 milligram and atropine 0.6 milligram because neostigmine and the action of the cobra venom both are post-synaptically. So that is the reason we give neostigmine. That's very important. Now, sir, what we do in cobra bite, beta? In cobra bite, as I told you, we give ASV anti-snake venom by IV route, neostigmine, atropine, and mechanical ventilation. Viper is vasculotoxic. V for viper, V for vasculotoxic. Here we give anti-snake venom, fresh frozen plasma. Why we give fresh frozen plasma? Because there is a bleeding. Viper is a vasculotoxic, bleeding. Surgical debridement because there is a maximum local symptom like gangrene and necrosis. Now, curated act on the presynaptic area. That's why no neostigmine, no atropine. We give ASV and mechanical ventilation. Again, I'm emphasizing on the point. In cobra bite, we give ASV, mechanical ventilation, neostigmine and atropine. Atropine is to just counteract the side effect of neostigmine. And neostigmine and cobra venom both act post-synaptically. In this, as I told you, my dear friend, Viper is a vasculotoxic. We give ASV. If there is a very severe bleeding, we give fresh frozen plasma and surgical debridement. That's very important. But in curated, because curated venom act presynaptically. करेत का जो टॉक्सिन होता है ना वो पोस्ट सिनेप्टिकली काम नहीं करता है. इट एक्ट ऑन द प्री सिनेप्टिकल साइट्स. दैट्स वाई नो नियोस्टिग्मीन, नो एट्रोपिन. यस, ये कॉन्सेप्ट समझ में आ गया. नाउ सर, व्हाट इज द राइट स्ट्रेटजी इन द स्नेक बाइट? वेरी वेरी इंपॉर्टेंट. आर फॉर रीएश्योर. सबसे पहले पेशेंट को रीएश्योर करो बेटा. आई फॉर इमोबिलाइज. जी एच, गो टू हॉस्पिटल ड्यूरिंग द ट्रीटमेंट ऑफ स्नेक बाइट. टी, tell the symptom and tell the history and start the treatment. Yes, very very important. Right, R, reassure. I, immobilize. G, go to hospital and tell the history and symptom and start the treatment very very fast. These are right strategy. Now sir, in autopsy with the history of drowning, no water was found in the lungs and was a case of dry drowning. What is the cause of death in this particular case? Tell me. What is the cause of death? There is no water in the lung. That's a dry drowning. What is the cause of death in this particular case? Tell me, dear. Is it laryngospasm, pulmonary edema, electrolytic abnormalities, and vagal inhibition? Yes. Without any doubt, it is laryngospasm. Dry drowning, no water in the lung. You die due to laryngospasm. Yes. So in dry drowning, there is no water. You die due to laryngospasm caused by vocal cord laryngospasm. This is very important and very simple one also. BNS for McNaughton rule 22, 23, 27, 82. BNS section for McNaughton rule, and I will make a very simple trick. What is the BNS section for McNaughton rule? BNS section for McNaughton. You become naughty at what age? That's a trick to remember. You become naughty at what age? Anyone? It is 22. Yes, 22. Because when you clear the 21 age, the age of marriage, you become naughty at 22. है ना? शादी की उम्र क्या है? 21. शादी के अब जैसे 21 क्रॉस किया, अब आप खुश हो जाते हो, भाई 21 क्रॉस कर दिया, अब मैं नॉटी हो जाऊंगा एट 22. सो एट 22 यू बिकम नॉटी, है ना? दैट्स वेरी सिंपल ट्रिक. सो प्रोटेक्शन ऑफ इंसेन एंड मैकनॉटन रूल कम्स अंडर 22 BNS. वेरी इंपॉर्टेंट, है ना? ट्रिक समझ में आ गया कि आप नॉटी कौन सी एज पे होते हो? 22, क्योंकि आपकी 21 की एज चली गई. 22 यू बिकम नॉटी एट 22. 33 वॉज नॉट BNS, दैट वॉज ए BNSS. BNS इज डेफिनेशन एंड पनिशमेंट. BNSS इज प्रोसीजर, क्राइम इंफॉर्मेशन टू प्रोसीजर. चलो, सब खुश हो, सबको एकदम इंपॉर्टेंट समझ में आ रहा है? चलो, एक्टिव प्रिंसिपल ऑफ दिस पॉइजन. ये लोग गलती करके आते हैं. पहले तो टेल मी व्हाट इज द नेम ऑफ दिस पॉइजन. दिस इज दतूरा. दिस इज दतूरा. यू कैन से, माय डियर फ्रेंड, इट्स ए थॉर्न एप्पल. इट्स एंटीकोलिनर्जिक वन. टेल मी व्हाट इज द मेन एक्टिव प्रिंसिपल ऑफ दिस पॉइजन. एनीवन हु कैन टेल मी? What is the main active principle of this poison? It is hyoscine. It is hyoscine. Hyoscine is more common. Atropine is very low. So it is hyoscine. So this is Datura, a devil's trumpet. Datura alba is white flower. Datura niger is a black flower. My dear friend, yes, without any doubt. Datura stramonium is a Jimson weed or thorn apple. All part of the Datura are toxic. The active principle are hyoscine, hyoscine and atropine. You can see hyoscine is the most common. Fatal dose are 100 seeds, almost 100 to 125 seeds, and one fruit of datura. भाई साहब, एक फ्रूट धतूरा में इतने सीड होते हैं कि that can kill 4 to 5 person. 4 to 5%. That's a very important few question of the Datura. 100 to 125 are fatal dose. So you can remember H4 hyoscine, H4 100 to 125 seeds are fatal dose. Okay. Now, sir, this question, a person comes to the OPD with burn injury to the right thigh on examination. There is a sodening. Doctor sir, there's a very important word, sodening of injury along with erythema, blister and line of demarcation that extend down to the limb. It means, sir, the burn is going to the down from the contact site. Okay. What is the most likely of the injury? Sodening word is there, going towards the down. Blister, erythema and line of demarcation is present. Yes, it is moist heat burn, which is a scald. Scald is a moist heat burn which is seen above 60 degrees centigrade. If your liquid or steam is above 60 degrees centigrade, that can cause scald. So it is without any doubt, my dear friend, it is scald more than 60 degree liquid or steam on the body, that is a scald or moist heat burn. You can see that this comparison, yes. These are some burn type. Dry heat burn, flame, moist heat burn, scald and chemical burn are corrosive. Sodening, what is the meaning of sodening? The skin become thickening and moist, that's a sodening. Dry heat, above the contact site, moist heat burn are below the contact site and chemical burn are also below the contact site. In dry heat burn, yes, in dry heat burn, splashing is absent. What is splashing? कि आपके ऊपर जो गिरा है, कोई छितराव है, जैसे आपने एसिड डाल दिया या लिक्विड और स्टीम डाल दिया तो स्प्लेशिंग होगी. बट इन ड्राई हीट बर्न इट इज बाय फ्लेम, नो स्प्लेशिंग. हियर स्प्लेशिंग प्रेजेंट, हियर स्प्लेशिंग प्रेजेंट. स्किन इज ड्राई एंड wrinkled in dry heat burn. Sodening and bleaching in moist heat burn, destroyed in chemical burn. Yes. Vesicle at the circumference surrounding the burn, that is a dry heat burn. This is a very important point. At the circumference in dry heat burn, over the burnt area in moist heat burn, rare in chemical burn. Very important, sir. Red line present in both burn, first and second. In chemical burn, red line and blisters are absent. Here color is black, here color is bleach. कलर चेंज हो जाएगा, ब्लीच हो जाएगा. एंड हियर इज अ डिस्टिंक्ट डिस्कलरेशन डिपेंड ऑन दैट थिंग विच यू यूज्ड. सो दिस इज अ वेरी वेरी इंपॉर्टेंट टेबल. ड्राई हीट, moist heat and chemical burn. Okay, so this is a very important table. Dry heat is a flame, moist heat is a scald and chemical is a corrosive burn. बहुत important topic है ये. Sodening, bleaching, these are seen at the moist heat or scald. Okay, in Barberio's test, yellow color needle shaped crystal are seen under microscope. What it is done for? What it is done for? Which stain? Semen, blood, CSF or sputum? Barberio test is done for which stain? Semen, blood, CSF or sputum? Anyone? It is semen. Without any doubt, it is semen. Barberio's and Florence test both are done for semen. We can see some pictures. Yes, semen analysis. We do few tests. Florence has C. It is for choline crystal, choline iodide crystal. Barberio's has S. It is for spermine picrate crystal. Spermine. Choline we can remember by chole. The chole color is brown. That is a dark brown crystal are seen in Florence test. Barberio's, Barber use yellow needle. So that is a yellow needle shaped crystal in Barberio's. And it is in Barberio's we use picric acid, and in Florence test we use potassium iodide and water. So देखो कैसे याद किया. Florence में C है, there is a C in Florence. It decide choline crystal, chole का color brown. That's it, done. Okay. Barberio's has S for spermine picrate. Picric acid we use, that is Barber use yellow needle. Barber क्या करता है? Yellow needle use करता है. That's a beauty. These are semen analysis test बेटा. Okay. ये तो semen के लिए हो गया. Florence and Barberio's. Now come to blood test. These are the tests for blood stain. Teachman test. Man color is brown बेटा. Man का color brown होता है. और Teachman. So there is a brown rhombic crystal. That is a Teachman for blood stain. These are hemine or hematine crystal. Takayama. One of the wonderful trick of Jhamad sir. That is a Takayama. Which color is Takatak? Pink color is Takatak. So if you get the pink feathery crystal, that is a Takayama test. तो अगर आपको पिंक कलर मिल जाए तो आपकी लाइफ टकाटक हो जाएगी. So your life become टकाटक if you get pink feathery crystal. है ना? Takayama gives pink feathery crystal to blood. Okay. Here we use glucose, pyridine and sodium hydroxide. It is a hemochromogen crystal. इट इज ए हीमोक्रोमोजन क्रिस्टल, है ना। तो अगर आपको गुलाबी चीज मिल जाए तो लाइफ बिकम टकाटक, और फ्लोरेंस हैज दैट टीचमन हैज मैन का कलर ब्राउन होता है, मैन का कलर क्या होता है, ब्राउन। दैट्स अ वेरी वेरी इंपॉर्टेंट बेटा। हाँ, नो इट्स कि भैया हमने कैसे याद किया, फ्लोरेंस में सी होता है फॉर कोलिन क्रिस्टल, कोली का कलर ब्राउन, ओके। बार्बेरियोस हैज एस परमीन पिक्रेट, बार्बर ना येलो निडल यूज करता है, दैट इज डन माय डियर फ्रेंड, ओके। टीचमन मैन का कलर ब्राउन, ये ब्लड स्टेन के लिए, टाकायामा पिंक फेदरिंग मिल गया तो लाइफ हो जाएगी टकाटक। वेरी गुड बेटा। सर सिफिलिक इंडेक्स ऑफ दिस 75 to 80 सीन इन विच कंडीशन बेटा, syphilic index of 75 to 80 which condition, Aryans, Chinese, Mongol and Negroid, it is B, Chinese, yes। चलो एक बार syphilic index पढ़ा देता हूं थोड़ा सा। syphilic index is used for RACE race, for syphilic index race, RACE race, syphilic index। what is syphilic index? breadth of skull divided by length of skull, breadth of skull, confuse मत होना बेटा, breadth of skull divided by length of skull, not length by breadth, breadth by length। ध्यान रखना सी के बाद पास बी आता है तो इसे ब्रेथ डिवाइडेड बाई एल। नाउ यू कैन रिमेंबर बाई DUMB, डम, यू कैन रिमेंबर बाई ट्रिक DUMB डम, और यू कैन रिमेंबर बाई दूध मिष्टान भंडार, चाहो तो किसी भी ट्रिक से याद कर लो। दूध फॉर डोलिकोसिफिलिक, मिष्टान फॉर मेसेटिसिफिलिक, भंडार फॉर ब्रेकेसिफिलिक, वॉट एवर ट्रिक यू वॉन्ट टू यूज, आइदर यू यूज दूध मिष्टान भंडार और यू यूज डम, बोथ आर ओके। Now dolichosyphilic, डोले शोले किस में होते हैं बेटा, डोले शोले आर सीन इन निग्रो एंड प्योर आर्यन। माइस, यू कैन सी द पिक द वर्ड माइस, M for mesetisyphilic, M for meseti, I for Indian, C for Chinese, E for European, the trick is mice, that's very simple, mice। and brachycephali are present in Mongol, and you start with dolichocephaly 70 to 74.9। मस्ती इंडिया वाले बहुत मस्ती करते हैं, तो मेसेटिसिफिली is seen in Indians, that is 75 to 79, and brachycephaly is in Mongol, that is Mongol। So very simple trick, again I am telling you, दूध मिष्टान भंडार, breadth of skull divided by length of skull, breadth of skull divided by दूध डोलिको, मिष्टान मेसेटी, इंडिया वाले मस्ती करते, चाइना वाले भी मस्ती करते, और मंगोल ब्रेकिसिफिलिक। वैल्यू 70 to 74.9, 75 to 79.9 एंड 80 to 84.9। बेटा हो गया क्लियर, इसमें गलती मत करना, दैट्स वेरी इंपॉर्टेंट। सर ए पेशेंट कम्स टू द कैजुअलिटी विद लाइफ थ्रेटनिंग इंजरी बेटा, देयर वाज नो टाइम फॉर टेकिंग कंसेंट, देयर वाज नो टाइम फॉर टेकिंग कंसेंट, द डॉक्टर स्टार्टेड डूइंग लाइफ सेविंग प्रोसीजर विद ऑल प्रिकॉशन, एंड डिस्पाइट बेस्ट एफर्ट द डेथ ऑफ द पेशेंट अकर्ड, पेशेंट मर गया। नाउ द डॉक्टर इज नॉट रेस्पॉन्सिबल अंडर विच कंडीशन, नाउ yes, no। Sejal is saying it is C, doctrine of extended consent. No, my dear friend, it is not doctrine of extended consent, my dear friend. It is doctrine of anticipation. It is doctrine of anticipation. I will explain both. You are confused between both, na? There is no word for conjugated consent in Indian medicine. Okay. Res ipsa loquitur is thing or fact which speaks for itself. Wait, beta. Wait. Okay. This is a very, very simple. If you are not taking any consent in emergency condition, this is doctrine of anticipation, which is in high risk patient. Okay. And what is doctrine of extended consent? Listen, my dear friend, here additional procedure or intervention beyond the immediate emergency may be required, and consent must be obtained for those procedure. Means something which is additional procedure is required, or intervention beyond the immediate emergency is required, that is doctrine of extended consent. Listen, my dear friend, emergency condition, no consent, doctrine of anticipation, and in some cases we require immediate emergency, then we require additional procedure or intervention, here consent must be obtained, that is extended consent. We take it extended consent. Are you getting my point or not? So that is a very, very important. So if you require additional consent for additional procedure for extension, that is extended consent. Okay. Res ipsa loquitur is a thing or fact which speaks for itself. Means doctor acted responsibly with all precaution, but there is an outcome which is unfortunate, that is res ipsa loquitur. So here, thing or fact which speaks for itself. Doctrine of conjugated consent is no word here. No word here. Now, sir, as a medical officer at PSC, you encounter a 17-year-old girl who has come to seek for a help for reported sexual assault. However, the girl declined to undergo physical examination. What course of action? 17-year-old girl has sexual assault की history है, लेकिन girl declined for the physical examination. What course of action would you pursue in this scenario? Okay, here what is the right option? It is option 1, 2, 3. Yes, yes, my dear friend. 1, 2, 3. My dear friend, she is denying. She is denying for physical examination, but you will start the treatment for STD and pregnancy. That's the duty of doctor. You will inform the police and you will record the refusal of consent. That is an informed refusal. You won't go for these two conditions because taking vaginal swab is a part of physical examination that should not be done, and start medical examination should not be done because girls denied for the examination. Okay? क्योंकि देखो, taking vaginal sample is a part of physical examination. You cannot go for physical examination because girl refused for physical examination, and start medical examination she refused. So there should not be 4 and 5. Listen, my dear friend, here start the treatment of STD and pregnancy, inform the police and record refusal of the consent. If she refuses, make it informed refusal. So here answer is option A. 1, 2, 3. So as I told you, start the treatment, inform the police and record the refusal of consent, but don't go for vaginal sample collection and don't go for medical examination because she refused, but go for informed refusal. In corrosive acid, stomach is opened from which side? Pylorus, fundus, lesser curvature, greater curvature. This one, yes, without any doubt, it is greater curvature. Yes, it is greater curvature. Okay. So brain, how to dissect the organ, my dear friend? Yes, how to dissect the organ, beta? Brain is put in the 10% formalin and we make coronal section of 1 centimeter in the brain. Heart dissection has to be followed by inflow-outflow technique, that is the right atrium, right ventricle, left atrium, left ventricle. That is technique has to be followed in heart. Okay. Brain में आपको क्या करना? पहले fix करना, then the coronal section of the brain, and heart you will start from right atrium, right ventricle, left atrium, left ventricle. Very important question. Spinal cord is opened from posterior approach, and stomach is double ligature method, and incision is made in greater curvature. For stomach, we made an incision in greater curvature. Because like most of the poisoning cases, the acid goes towards the lesser curvature. That's why we make a incision on the stomach for greater curvature. That is a double ligature method. Spinal cord is by posterior method. तो मैंने चारों मेथड बता दिए. ब्रेन को पहले फिक्स करो, देन कोरोनल सेक्शन लो. Okay, heart dissection, right atrium, right ventricle, left atrium, left ventricle, spinal cord posterior, and stomach greater curvature. Very important. So good luck, goodbye.